Hi, my name is Bianca Runauer. I am going to talk about observational study of hydroxychloroquine in hospital patients with COVID-19. Definition: hydroxychloroquine is a medication used to prevent and treat malaria in areas where malaria remains sensitive to chloroquine. It is also being studied as a treatment for coronavirus disease 2019 or COVID-19. Also, evidence for its efficacy is lacking.
Your medication, hydroxychloroquine. Hydroxychloroquine is also known by the brand name Plaquenil. Hydroxychloroquine comes in a tablet dosage form, and it's most commonly used to treat or prevent malaria or to treat rheumatoid arthritis. Hydroxychloroquine is taken by mouth with food or milk. If taken for malaria prevention, hydroxychloroquine is taken once a week. If taken for treatment of rheumatoid arthritis, hydroxychloroquine is taken once daily.
COVID-19 is a disease caused by a new strain of coronavirus. CO stands for corona, VI for virus, and D for disease. The COVID-19 virus is a new virus linked to the same family of viruses as severe acute respiratory syndromes and some type of common cold.
A coronavirus is a type of virus that can infect the respiratory tract, meaning the nose, mouth, throat, sinuses, or lungs. There are many types of coronaviruses, and most cause only mild illness, such as the common cold. But some coronaviruses can cause severe illness. The most likely way people can become infected is by droplets that contain the virus. These droplets carry the virus into the air and can enter through the nose, mouth, throat, and lungs of a person who is within 6 feet or 2 meters. The virus infects the lungs, causing the lungs to become inflamed. The alveolar sacs have to be healthy for the body to breathe in oxygen and breathe out carbon dioxide. Infection of the virus causes damage to the cells of the lungs and triggers an inflammatory reaction. Fever may develop. With severe inflammation, inflammatory fluid fills the lungs. This reduces the function of the alveoli, resulting in coughing and difficulty breathing. The oxygen level in the blood may decrease. In some people who become severely ill, other organs may be affected, such as the kidneys or the heart.
Applications in medicine. The National Institute of Health sponsored research into the treatment of COVID-19 with hydroxychloroquine, which has been widely used in this setting despite insufficient evidence to justify the practice. Investigators in New York City analyzed single-site data on 1,376 coronavirus patients, including 811 who received a 5-day course of hydroxychloroquine. They were interested in what proportion of hydroxychloroquine patients met a composite of intubation or death during median follow-up of 22.5 days, relative to COVID-19 patients who did not receive the drug. Approximately 1/4 of the study sample satisfied a primary endpoint event, including 180 who were intubated, 66 who subsequently died, and 166 who died without being intubated. The time to event analysis found no greater or lower risk of intubations or death with hydroxychloroquine received versus not received. The researchers agree that randomized controlled trials of hydroxychloroquine are warranted to determine their value for patients with COVID-19.
It's been touted as a potential game changer.
I think it's going to be very exciting. I think it could be a game changer.
But 2 new studies on the effectiveness of the malaria drug hydroxychloroquine continue to douse hopes that the drug could help patients affected by the coronavirus. One of the studies was carried out in France last March. 84 patients were treated with hydroxychloroquine and 97 were not. The results suggest that there was no meaningful difference between the groups when it came to the rate of transfer to ICU units and to survival rates. That has led to the following conclusion by the authors of the studies, who say that the results do not support the use of hydroxychloroquine in patients affected by COVID-19 who require oxygen. The second study conducted in China even reported a higher rate of adverse effects for patients who received hydroxychloroquine. 10% of patients treated with the drug came down with diarrhea. Hydroxychloroquine and the related compound chloroquine have been used for decades to treat malaria, lupus, and rheumatoid arthritis. A major American study on the use of the drug combined with the antibiotic azithromycin is currently underway. This study will enroll about 2,000 adults at clinical sites across the United States, many of whom have another condition or chronic disease.
Pros and cons. Pros. Is used to prevent or treat malaria caused by mosquito bites. Is also used to treat autoimmune disease like lupus or rheumatoid arthritis. It belongs to a class of medications known as disease-modifying anti-rheumatic drugs. It can reduce skin problems in lupus and prevent swelling or pain in arthritis. Cons. This medicine has adverse effects like nausea, vomiting, stomach pain or cramps, loss of appetite, weight loss, diarrhea, muscle weakness, twitching, uncontrolled movement, loss of balance or coordination, blurry vision, light sensitivity, seeing halos around light.
Some common side effects with hydroxychloroquine include mood changes, bad dreams, fever, chills, headache, upset stomach, diarrhea, and fatigue. Some less common side effects include ringing in the ears, seizures, and muscle weakness.
Issues apply in Ecuador. In March and April, hundreds of Ecuadorian families were looking for medication to combat COVID-19, which triggered respiratory problems in their relatives. Among these drugs was hydroxychloroquine, which have run out due to high demand and the hoarding of 13 people in those days. Many use social media to request that this medicine be sold to them. Those channels become showcases for supplies and demands. Conclusion. Hydroxychloroquine is classified as an anti-malarial drug. It is similar to chloroquine and is useful in treating several forms of malaria, as well as lupus erythematosus and rheumatoid arthritis. In the latest evidence found by studies carried out in China and France, hydroxychloroquine is definitely rejected as a possible treatment for the new coronavirus. This evidence rules out hydroxychloroquine for patients with COVID. Collect a publication from the specialty portal on health medical writing.